volume 2, please.
Yes.
And you, I think the very first item in volume 2 started with page 369. Can you confirm that those are your submissions that are very true to the best of your knowledge and understanding, and that you wish them to stand as your evidence to the Commission?
That's correct.
I wanted to ask you first of all about some of the issues you raised on the second page of your submissions. You were talking about working relationships between the local authority and health professionals being in difficulties, and I wondered if you could assist with the specifics of where that information came from.
That information has come following meetings of the Health and Adult Social Care Association groups PAC, where I talked to numerous local NHS doctors and managers, as well as meetings I've had with certain professionals within the NHS, both at the CCG level and at the trust level.
And can you just expand a little on what they are saying to you?
A lot of it is taken from my perception of the meetings and how especially senior members of the council have been behaving towards NHS staff, and then comments made by individuals following those meetings in which they express significant unhappiness at the way they were treated.
I don't think you have to, but is that something which is documented anyway? It's a way to find it.
No, it wouldn't be. I don't believe it's documented. However, I'm sure you'll be speaking with members of the NHS.
Well, I wanted to ask you, in fact, about that. Do you consider that it's important for this Commission to hear views from all sides of this debate?
Absolutely.
And does that include hearing evidence from the NHS bodies that you suggest may have been subjected to unfair criticism?
Of course, I think the NHS are probably the most important people to give evidence.
It's really important that they attend.
Of course.
Now, I wanted to ask you also about this. You say that you think things have sometimes gone beyond legitimate scrutiny. What impact do you think that this has had on the process so far?
A key part of the Shaping Healthier Future proposals are any changes to the provision of healthcare across North West London are about better integration of health and social care. Now, the working relationships between the NHS and the councils across North West London, who obviously have a very important role within providing social care, public health, and better integration of health and social care through the Health and Wellbeing Boards, through the Better Care Fund, and all those different aspects. I think that's fundamentally important to the success of the Shaping a Healthier Future. And if that is not able to take place, then it surely puts into doubt whether some of the significant changes to acute hospital trusts can take place. One thing I want to state, and just going on from some of your questions that I heard a few moments ago, I reject the concept that the A&E at Charing Cross and also Ealing are not going to be A&Es. That is something that we reject and has been guaranteed by the Secretary of State for Health and by the Prime Minister. Now, I know there is uncertainty over how those A&Es will be. Also, that is related to the PO review into emergency medicine. However, the Conservative group and my support for any changes to acute trusts within North West London is for the A&E at Charing Cross and also Ealing, but I'm speaking primarily for this borough, is that the A&E at Charing Cross remains recognisably an A&E, and it remains with consultant leadership
Can I
and staff.
ask you about that? In fact, one of the topics I obviously want to cover with you. Is it your understanding that the, call it what you will, emergency service, for want of a better phrase, at Charing Cross Hospital is going to have consultant-led arrangements or GP-led arrangements?
We've been told at many meetings since May that the leadership of the A&E at Charing Cross and Ealing will be consultant-led. Now, however, the slight uncertainty about that is over the KEO review. Now these changes looking forward, 5 years up to 2020 and beyond. So as far as I'm aware, and as far as I've been told, the leadership of the A&Es will be consultant-led.
Do you know whether that means that there will be consultants on site 24/7 or not?
Again, it's not something that I can know for certain. However, I've been told, and I would believe, and I believe it should have consultants on site consultants currently aren't on site 24 hours, 7 days a week. And one of the documents that I've referred to is about 7-day consultant present care. And I think it's important that NHS trusts move towards much greater coverage of consultants present 24 hours a day, 7 days a week. And since the changes specifically to the Hammersmith A&E, the coverage of consultants across the Imperial NHS Trust has been augmented by the recruitment of additional emergency medicine consultants, and that has increased the amount of time that they are present in the A&Es.
Could I just ask you to pause there, because I want to ask specifically about that. Do you know, I was going to ask you whether that drive for recruitment has borne fruit. Do you know the extent to which that has happened?
We have asked questions relating to that PAC, Health and Adult Social Care Policy and Accountability Committee. I wasn't at the last one because I'm on paternity leave and just recently, my wife has just recently had a baby. So I don't know if that has been, I don't know whether that's been clarified. However, I do believe that they have now recruited some additional emergency medicine consultants from what I've been told, and that hopefully all, I believe it's either 6 or 8 new posts have been created, and that they will hopefully all be filled very soon.
And is it correct, if I understood you correctly, that your support for the plans for the emergency care centre at both CCH and Ealing is predicated on it being consultant-led?
Absolutely.
And there being good or better coverage than now?
Absolutely.
And on those units being able to admit ambulances where appropriate?
I think the point with regards to admitting ambulances is important. I think that the term blue light is very misleading, because I think the public and many of us in this room will consider any ambulance to be blue light, whereas the NHS and the ambulance service consider a very small proportion of ambulance journeys to be blue light admissions.
Can you clarify for the Commission, please, whether your support is in relation to must blue light ambulances be admitted or other ambulances? Can you help us with what exactly you're saying about which ambulances are appropriate?
Of course. Yeah, this is the very specifics of this question is something that's probably best answered by the ambulance service and by the NHS. But from my opinion, I believe that certain blue light ambulances should still be appropriate for Charing Cross. However, ones, for example, such as major trauma, as currently is the case, should go to St Mary's, where they have some of the best trauma, mortality rates in the world. For cardiac care, they should go to the Hammersmith, where they're a centre of excellence for heart attacks and other cardiac treatments. Currently, the stroke centre is based at Charing Cross, but as part of the changes, that is being moved to St Mary's, so those patients would go to St Mary's in the future. But for other blue light cases where it is clinically appropriate and safe to do so, then they should still continue to go to Charing Cross.
So do I have that where there is a specific specialist unit dedicated to a particular condition, the blue light ambulance should go there, but otherwise the blue light ambulance should continue to be able to go to Charing Cross or Ealing A&E?
I believe so, yes. And just to pick up on something that the previous person mentioned regarding to whether every A&E should have the backup of, say, a stroke unit or other specialist services. I disagree with her point because, especially with regards to stroke, the centralisation of stroke units across North West London have saved thousands of lives and reduced disabilities from stroke for thousands of patients. And then this part of London, and London as a whole, has some of the best stroke outcomes in the country. And that is because London was the forefront of centralising these hyper-acute services.
Do you have a view, do you have a view about the move from Charing Cross to St St Mary's of the hyperacute stroke unit, and whether that was or wasn't appropriate?
Speaking as a councillor for this borough, it is, in my mind, a shame that the stroke service is moving, because obviously it's a service that is exceptional. It is right on our doorstep, and from that local perspective, in many ways I wish it could stay. However, from what we've been told by the local clinicians and the local NHS, they believe that having a stroke unit at the St Mary's site, where it has the co-location with the major trauma unit, with the additional intensive care facilities, that would provide even better patient outcomes. From a very local perspective, in many ways I would like the stroke unit to stay. However, the clinical expertise is saying that more lives will be saved by transferring that unit to St Mary's. Now, of course, people are concerned about ambulance journey times, and that's something that obviously has to be worked into the plans extremely thoroughly. And in many parts, in other parts of Europe and other parts of the world, many of the treatments and the diagnoses of stroke is actually being taken place by the paramedics in the ambulances, and treatment can start before a patient even gets to the hospital. So this is all something that needs to be built in further down the line before these changes take place.
Just lastly on that point, are you able to help with what your constituents are saying about the move of that unit?
Obviously, I've spoken to many constituents about the changes to local healthcare services. A lot of that was prior to May, but there's been many conversations since May as well. It is something that's brought up by some people, but a small proportion compared to the bigger concern, which is the A&E services.
And just turning back to the A&E services, we know, of course, that there were the closures at Central Middlesex and at Hammersmith, and you set out that your view is that was necessary on safety grounds. And we know, though, don't we, that those closures took place in a way which was not following the original plan. And I think you said that more should have been done to prevent that. What should have been done?
I think the question is kind of conflating two issues. The first is the independent review panel recommended the closure of the A&E at closure of the A&E at Hammersmith and Central Middlesex was brought forward, and that's why that decision and the plan to do so happened in September rather than either later in 2014 or 2015. I'm not 100% sure on the exact original timings that were proposed. And my knowledge is better regarding Hammersmith Hospital for obvious reasons. And that was due to the fact that for many, many years, I think up to 10 or even 15 years from what we've been told by local doctors, there haven't been emergency medicine consultants at Hammersmith. And that is not because of funding or anything like that. It's because the caseload at Hammersmith has changed to such an extent that because of its specialisation as a cardiac centre, it was staffed extremely well by cardiologists and also renal physicians. But it wasn't suitable to train A&E emergency medicine doctors, and that meant that the posts for consultants couldn't be emergency medicine consultants, and that meant that the A&E was staffed by locums, both at a consultant and at a junior doctor level, and that, for very many reasons, creates a situation in which for patients is potentially very unsafe, where there isn't that continuity of clinical leadership, where there isn't that ability to, as a team working together, build on national and local strategies to improve patient care. So I think that's the reason why I don't know about Central Middlesex specifically, but for the Hammersmith, that's why the staffing was unsafe.
And what you said, you were told at the time that those unplanned, brought forward closures wouldn't create a reduction in service quality.
We were told
You said you were given those assurances.
We were given that assurances both at the Policy and Accountability Committee, and I also attended the CCG meeting, which was in St Paul's Church in Hammersmith. I think that was around late May or maybe June, where in depth they went through their planning for the changes to the A&E facilities. I think that there are two big problems with regard to what's happened since then. The first is unfortunately out of anyone's hands really, and that's the mutation of the strain of the influenza virus, which was the primary virus used in the influenza vaccine. I think that has nationally created a much greater pressure this winter on A&E services, both in England, Wales, Scotland, Northern Ireland. And then locally, I think it is very regrettable that the new A&E facilities at Northwick Park were not completed on schedule.
Is it a concern to you that the information that you were given that gave you those assurances turned out to be inaccurate?
Yes, I guess in many ways it is a concern that the A&E facilities at Northwick Park weren't completed on time. That's something that, you know, I don't want to speak ill of areas of London that aren't part of, you know, this immediate borough, but that's something that is a question for both the trust at Northwick Park and also the CCG covering that area. With regards to what's happened locally in Hammersmith and Fulham, with regard to the changing demands on A&E, both at St Mary's and Charing Cross, I think that is explained more by increasing demand on A&E services on a regional and national basis, and also perhaps some knock-on effect from the difficulties experienced at Northwick Park.
Specifically, though, does the fact that the information that you were given that it wasn't correct, does that give you any cause for concern in relation to other assurances or information which you're currently being given?
I think any plan from any organisation, especially the NHS and healthcare, is such a complicated system, such a complicated area of expertise, that any plans obviously become relatively out of date as soon as they are started to be implemented. And people have to react to those plans as quickly and efficiently and effectively as possible. And from what myself and other councillor colleagues have heard from Imperial relating to their NHS, their A&E waiting times, they have plans in place to improve their waiting times. However, I think that with regards to the plans for shaping a healthier future, I think specifically asking your question about whether I have concerns about that, I think it is sensible to have more contingency in the plans, especially with regard to bed numbers, and the original proposals for shaping a healthier future, specifically relating to the Charing Cross site, had much fewer bed numbers than is currently proposed. And I would personally like to see more contingency built into their planning for what will happen if, and we hope that this won't be the case, if their out-of-hospital plans, working with the council and other providers, doesn't bear fruit for the reduction in demand that they are calculating.
So there's a degree of uncertainty there.
Of course, there's a degree of uncertainty in any plan that goes 5 or more years into the future. And I think one particular area of uncertainty that perhaps the NHS needs to take better consideration over is the proposed increase in population in northwest London, in particular relating to the redevelopment of the Old Oak area relating to the HS2 interchange and all that that potentially add tens of thousands of new homes.
When you say need to take more notice of, does that suggest that you're aware of any problems with the statistical analysis thus far in terms of population?
I think the NHS has used, I'm sure it must have used very tried and tested means of predicting population growth and growth in demand for services. You know, that's something that they must be extremely capable and experienced in doing. However, I think the potential growth of population in that area specifically, in North West London as a whole, may be out of the ordinary and may not be fully factored into their calculations.
I just wondered if you could expand very briefly.